Hello, and thank you for joining us for another episode on dental malpractice. In this episode, we're going to be talking about nerve damage after dental injections. Nerve damage can be extremely painful and devastating. In fact, these are some of the most heartbreaking cases in dental malpractice. Think about it. When your nerves are permanently injured, it can cause extreme difficulty in almost every social interaction, whether it be eating a meal or talking with a friend. This kind of damage can cause a patient serious depression. It can cause people to become reclusive and withdraw, and it can even cost some people their jobs. Thus, nerve damage is a common reason people file dental malpractice claims.
Many dental procedures involve injections of anesthetic, whether it's a routine dental procedure or a surgical procedure. This is the part of the dental procedure that we all fear. I don't know about you, but when I'm laying in the dental chair and I see that needle coming my way, it's an instant anxiety attack. At the end of the day, the pain is usually short-lived, and honestly, the pain of the injection is better than going through the dental procedure without anesthetic. However, it's not that easy for some people. Sometimes the dentist damages a nerve during the injection, and sometimes that nerve damage is permanent.
So, how do I know if I have nerve damage after a dental injection? Well, let's talk a little about some of the symptoms you might experience if you've received a traumatic dental injection. You might experience a lack of sensation in the area of the injection that lasts more than it should, like a day or so. You might experience numbness in your tongue, gums, cheeks, jaw, or on your face. You may notice an odd sensation like a tingling sensation or a burning or crawling sensation in your tongue, gums, cheeks, jaw, or face. Here's the scary one: loss of taste or alteration of taste. You may notice that some foods taste metallic or rancid or otherwise strange. You may start biting your tongue and your cheek more often than you usually did. And finally, as we discussed, you may experience difficulty speaking and eating.
So, what is the dentist supposed to do if he or she causes nerve damage during a dental injection? Here, we're talking about the standard of care in the field of dentistry. In a dental malpractice lawsuit, the attorneys must employ expert dentists to opine as to the standard of care. However, you can also find information regarding the standard of care on the state's disciplinary agency's website. In Florida, for example, you can look up agency decisions regarding the standard of care in cases where a dentist damaged a patient's nerve after the dental injection. These administrative complaints provide that a breach of the standard of care in the field of dentistry, specifically regarding nerve damage after injections, includes some of the following. 1. Failure to examine or identify specific areas of decreased sensation. 2. Failure to refer a patient to a dental or medical specialist. 3. Failure to timely perform an appropriate neurologic evaluation of the patient. 4. Failure to timely evaluate and or diagnose a patient's postoperative complications. 5. Failure to timely refer a patient to a specialist or otherwise provide adequate treatment for the postoperative complications.
As we've alluded to, nerve damage in the tongue and face can wreck a person's life. Nerve injuries can ruin a person's ability to enjoy a meal. In the same way, nerve damage can alter a person's speech and in turn destroy a person's confidence in social situations. Overall, the disabilities caused by nerve damage can cause a person to stop interacting with people and to become depressed. However, there is a bright side to this story. Nerve damage will often resolve. In other words, depending on just how bad the nerve damage is, it may heal on its own. The key is to seek help as early as possible to make sure that your nerves have the best chance of healing. If it goes too long without the care of a doctor, the nerve damage may become permanent, which can require serious surgery to reattach the nerve, and that type of surgery is not guaranteed to fix the problem.
Thank you for joining us for another episode on dental malpractice. If you find this content interesting, please like and subscribe, and we'll see you at the next episode.